Hey gang, must be Wisdom Wednesday. Hi, I'm Mark Sweeney, owner of Austin Dental Spa. If you've tuned in before, then you know that every Wednesday around this time we do a little scientific topic. There's a new theme every month, which this being the first episode of December. I'll introduce that in a second. And then I usually give a helpful health tip at the end. So if you're wondering what I'm doing with this goofy hat on, well, it's because our theme in December is a December to remember. And so that's why I've got the light bulb on. And we're also going to be talking about brain functions today. What the heck do brain functions have to do with anything going on in your mouth? Well, that's exactly what we're going to be talking about. So, first of all, you might have noticed that the facial hair from last month is gone. Last Wednesday was the last day of November, and it came off Thursday morning, December 1st. I grow it every month, every November for men's prostate awareness. So last week I had a full beard. This week, poof, gone. Want to see it again? Wait till next November. So anyway, like I've already said, this month our theme is a December to remember. And boy, what a year 2022 has been to remember. I think probably next month we'll work something into a year to forget. Because 2022 didn't turn out to be the way most of us thought or hoped it was going to be. Anyway, as I brought up already, what does the brain have to do with the mouth? One would think that they're not really connected at all, and 40 years ago in dental school, they taught us almost nothing about things that were going on in the mouth affecting the brain, because honestly, we just didn't know that much. But now things have changed considerably, and we know that there is what we call the oral systemic connection, meaning the connection between the mouth and the rest of the body. The bacteria that hang out in your teeth as you're chewing, if you've got bleeding gums, some of that bacteria is going to get picked up in your bloodstream, and it passes all the way through your bloodstream. It can show up a number of places. We've already done episodes before of how it can affect your gut biome, the bacterial flora that lives in your intestinal lining. Today, though, we're going to talk about gum disease and particularly dementia with a little tangent out there into Alzheimer's, which I happen to have more experience with than I would like to admit with both of my parents, who are both deceased now. But how does gum disease tie into dementia? Well, there are multiple ways, and research now, just in the last 10 years, has found a direct link. They don't know if it's cause and effect, but they know that there's a link between people who have unhealthy mouths being much more likely to suffer from dementia, which is a disease that typically occurs later in life, 80s, 90s, thereabouts. But it's starting to happen earlier and earlier as scientists are learning more about it. A lot of cases of dementia apparently went undiagnosed back 30, 40 years ago. And people just didn't live as long as they're living now. Yesterday I just saw a World War II veteran, he's 99 years old. In June he turns 100, and he's still sharp as a tack, and has some great stories to tell. And we did a crown on a tooth. So that's how young he thinks he is. He's planning on being around. He asked me if I was giving him a 99-year guarantee on the new work. I said, if you make it 99 years, I'll give you a guarantee, another 99. So anyway, part of the reason why he's still around and still as sharp as he is, because the guy's got a great sense of humor. And he flew airplanes in World War II as part of the Naval Air Force. So anyway, there's been a link for at least 10 years. We've known that there is a link between gum disease, one particular bacteria type that causes gum disease. There are over 30 types of bacteria that can cause gum disease, but P. gingivalis, the P stands for porphyromonas, which everybody just calls it P. gingivalis. That particular bacteria is a spirochete in the classifications of bacteria, and it travels nerve pathways. And when they started studying Alzheimer's, which unfortunately they can only do in people who have died in order to section their brains, they kept finding this plaque, kind of like the plaque that forms on your teeth, in one specific part of the brain, lower outer left, in the posterior part of the cerebrum. And the researchers were struck by this, that everybody that died with Alzheimer's had some of that plaque in the same spot in their brain. And what they found in that plaque was P. gingivalis. The only other place they find it in the body is in the mouths of people with severe gum disease. So they started drawing it. They can't say that gum disease causes it, but it is a link. That means we don't understand the association completely, but there is some kind of connection. And some of the theories are that it starts in your mouth with the P. gingivalis, and it travels up the nerves. From gum disease, it travels up the nerve pathways and gets into your brain, and then finds its way to that one specific area of the brain, and that's where Alzheimer's potentially could start. That's not been proven yet, but we do know that those are the only two places that we find P. gingivalis. So there is a link. So I tell my patients, if your gums are bleeding, if you've got especially severe disease, why take the risk that you're upping your chances of having dementia or Alzheimer's? There's a slight difference between those two. So gum disease, if you've got gingivitis, if your gums are bleeding, if your toothbrush turns pink, or if you use a water pick and the water comes out of your mouth pink, it's good to get that taken care of. It's easily treated in the mouth, a little harder to get at once it gets through your body. How about tooth infections? Tooth infections and memory loss. They're doing studies right now, and some of them have already been published, that they're finding that people that have tooth infections, that especially on the lower teeth, the nerves and the blood vessels to all your lower teeth come from each side, directly out of your brain, drop down in front of your ear, go all the way up to about here, and then they meet in the front. And so if you get an infection in a lower tooth, and it gets down out of the tooth and into the tissue, I don't know what was in the water, but I had 4 patients over Thanksgiving and then the week after Thanksgiving that came in with faces swollen, from young in their 30s to in their 80s. But all of them came in with their face swollen, with an infected tooth that had gotten out into the tissue. So it's not an uncommon thing. It's actually rather common. All needed root canals to treat the infection that started in the tooth. But by the time it gets out into your tissue, it can get picked up. If it's the P. gingivalis, it can get into the nerve pathways and climb up that nerve and go directly up into your brain. Why take the risk? So take care of your teeth. Dementia and tooth loss. This is a really interesting study that just came out last year, that they found a direct link between people with early onset dementia and people that had lost a number of teeth. And they don't understand exactly what that link is. But again, they found that people that were missing multiple teeth, especially back in the back where they chewed, had a much higher incidence of developing early onset dementia, which means memory loss, inability to remember where you're going, what you were doing. So taking good care of your teeth is an important aspect. So I went through all those. If you get on the internet, you can find the same studies I did, linking oral health and brain health. And so you want to take care of any kind of bacterial infections, because they create inflammation in your body. Like I talked about, that oral systemic connection. It can create inflammation anywhere in your body is not a good thing. So you want to try to, our deal is everything from the head and neck up. And so pretty easy to get your teeth clean. Might be a good New Year's resolution for you if you've got any kind of bleeding, or if it's just been a while since you've been to the dentist. Get that taken care of. My health tip for the day: hug somebody. Now, they've done some research on this too, by the way. It's not, I mean, hugs feel good, but researchers found that if you hug for 20 seconds, now 20 seconds seems like an eternity if it's your grandmother hugging you and you smell that old lady cologne, but perfume. But anyway, a hug for 20 seconds or more ups the level of oxytocin in your system. It's an enzyme or a hormone created in your brain when you feel good, and it makes your whole body feel good. So these researchers found that a hug lasting 20 seconds or longer shot the oxytocin level up way beyond a quick little hug, 5 seconds and done. So holidays are coming up. We're going to see family. Use that 20 seconds. Tell them when you're grabbing them and hugging them that you're going to count to 20, and it's going to help their brain. Speaking of, brain health, oxytocin is like a sunshine and cool weather for the brain. So take care of yourselves. We'll be back next Wednesday for another version of Wisdom Wednesday. Stay safe.